Greetings. I'm Dr. Anil Sipahimalani, Medical Director at Cigna. My responsibilities include clinical oversight over health and wellness programs, as well as chronic disease management programs. I'm also a member of Cigna's South Asian Colleague Resource Group. Today, I'd like to share with you some interesting facts about diabetes and heart disease in the South Asian population. This is a topic near and dear to my heart as I grew up in Mumbai, India, and attended medical school there before moving to the US. I'll start with some demographic information, then talk about the high incidence of diabetes and heart disease in the South Asian community, along with some of the reasons for this difference. In a separate video, Dr. Sheila Sudhakar will then tell us about ways we can improve this discrepancy by influencing South Asians to move towards healthier eating and exercise habits. So, who are South Asians in the US? These are individuals who trace their origins to Bangladesh, Bhutan, India, the Maldives, Nepal, Pakistan, and Sri Lanka. There are nearly 4.3 million South Asians in the United States, the majority of them being first-generation immigrants, most having immigrated after 1960. Among all ethnic groups, South Asians are the fastest growing population in the US. Indians comprise the largest segment of the South Asian community, more than 80% of the total population. And where are South Asians located in the US? Well, the 5 states with the largest South Asian populations are California, New York, New Jersey, Texas, and Illinois. So let me share with you some cardiovascular disease facts in South Asians. Among all ethnic groups, South Asians have the highest risk of cardiovascular disease. South Asians are 4 times as likely to die of cardiac disease than the general population, and also have a much greater chance of having a heart attack before age 50. On the average, South Asians develop heart disease up to 10 years earlier than the general population, and almost 1 in 3 South Asians will die from heart disease before age 65. How about diabetes? The story is not that different for diabetes. South Asians are 4 times more likely than any other ethnic groups to develop type 2 diabetes due to a combination of genetic, social, and environmental factors. They are also more likely to develop diabetes at lower BMIs than the general population. For the general population, physicians will often screen people who are overweight, which is a BMI greater than 25, as they are more at risk for diabetes. However, it's been found that South Asians have the same risk at BMIs above 22, which is considered within the normal range. Part of the reason is body composition. South Asians have more abdominal adiposity, which is the fat around the middle, and that confers greater metabolic risk and leads to insulin resistance. It's also estimated that close to half of all South Asians are affected by metabolic syndrome, which is the combination of increased waist circumference, abnormal fasting blood sugar, abnormal lipids, and hypertension, which appears to be a major risk factor for diabetes and heart disease in this population. So why is this the case? What are the causes for the increased prevalence of diabetes and heart disease? Well, there's a genetic predisposition, as we talked about. There are also some other factors that we got to consider. One is body image. For many South Asian immigrants, they associate a larger body type with sound health, which affects the motivation to engage in healthy lifestyle behaviors. There's also a misconception about physical activity. Devoting time to exercise is often viewed as taking time away from caring for the family, cooking, and tending to children's needs, and is therefore felt to be culturally inappropriate in their families and communities. There's also the role of gender. In the South Asian group, traditionally, women cook and take care of the family. Males are the head of the households, and they do exert influence over dietary decisions and are often resistant to dietary modification. Many families do not believe it's possible to modify their dietary habits while still maintaining the inherent cultural and ethnic qualities of their diet. Smoking, that's another major issue. There's a higher incidence of smoking, which of course is associated with greater risk of diabetes, heart disease, and early mortality. And last but not least is the diet. So studies have shown that in the South Asian community, besides low physical activity levels, there's also low fruit and vegetable intake, and there's high carbohydrate intake. White rice and other refined grains, which are linked to increased incidence of diabetes, make up a large proportion of daily energy intake in Asian diets. Unhealthy trans fats and saturated fats, such as palm oil, are often used as cooking oils. So you can see that while many people have the idea that a vegetarian South Asian diet is healthy, that's not often the case. I hope I've given you some idea of the epidemic of diabetes and cardiovascular disease among the South Asian community, and that you watch Dr. Sudhakar's videos, which will give us general strategies to improve the health of the South Asian community. Thank you for watching and have a great day.